Hi, can everyone hear me okay? Great, okay. Oh, there, thumbs up in the back, great. Hi, thanks for coming today. My name's Jean Flickinger. As my friend Daniel introduced me, but I'm a physical therapist at CHOP. I've been at CHOP for over 25 years. I know I don't look like I could be working there for 25 years, but I've really been fortunate to work at this amazing institution and with our Mito team at CHOP. It has been great. Before I start my talk, I just wanted to give you guys a huge shout out. We've been really having a lot of fun in our research pavilion. I think anyone out there that's gone through our testing, yeah, quite a few of you, I recognize the faces out there. Thanks for coming out and supporting our research clinical study. It's been a really fun experience getting to know everybody. So today, I know you just met with a bunch of great therapists, physical therapists and other speech therapists, orthotists, who kind of focused on the clinical side of things. Most of my talk will focus more on our outcome measures and clinical trial readiness. So since you all have been sharing your families with us here, I thought I'd just show you my family. My husband, I have 3 daughters. Two of them are actually young adults now, so but, we're from Philadelphia. And a little bit more about my background. As I said, I've been at CHOP for 25 years. I did 2 years in adult therapy when I graduated PT school, so I have a little bit of adult experience prior to CHOP. And I'm lucky to now be able to see adults again in our mitochondrial program. Prior to joining our mitochondrial program in 2017, I worked for years in our neuromuscular program, so I've had an amazing experience with some other neuromuscular disease groups, in particular spinal muscular atrophy. I've been involved in their clinical trials, from helping to create their outcome measures all the way through. They have several treatment options now, including gene therapy. So that has motivated me to really help mitochondrial disease get ready for their clinical trials. So sorry, this is quite a busy slide. I'll turn here. So this is just some of the slides that from different SMA papers when treatments became available for SMA. The SMA community was definitely ready. They had really great natural history data, and the physical therapy outcome measures were a big part of helping to get the drugs approved. They actually were able to do a fast track FDA approval for one of their drugs because the data looked so good. Just gonna have a little sip of water here. So the first graph here just shows you, it's the CHOP Intend, and is used in severely affected infants with SMA. And you can see the curves show a downward trend. And that was the natural history prior to treatment. So that when treatment came available, this middle slide here, can you hear when I turn? Maybe I'll turn this way. Okay, so the middle slide in the blue is the treated group, and it's their CHOP Intend scores change over time. So you can see the scores went up for the treated group and down for the untreated group. And then for different types of SMA, later onset SMA, they used a different outcome measure called the Hammersmith expanded. And the treated group, again, is in the blue. And you can see, again, the trends were up for the treated group and progressively worse for the untreated group. So just to demonstrate the importance of gathering that longitudinal data, if you were at Dr. Zakipli's talk this morning, you'll see some of the similar slides from that talk. I'll be talking a lot slower than Dr. Zakipli did this morning. So, and feel free, if you have questions about particular slides, feel free to raise your hand. We can make this more interactive if you'd like. So this is our Coast. If you came to our clinical pavilion, you would have tried out some of our Coast measures. This is our validated outcome measure that we developed, and we look at 5 different domains: muscle strength, muscle fatigue, balance, exercise intolerance, and dexterity domains. And you can see there is a paper out on this. It was published in 2021 if you're interested in taking a look at it yourselves. We found that our group was weak in elbow flexion, wrist extension, hip flexion, and ankle dorsiflexion by looking at our data as a group. Those 4 muscles seem to be the weakest in our group. And we'll kind of go through each of these domains in a little more detail. So here we are we use a handheld dynamometer, so it tells you specifically how many pounds someone's resisting. And we have age-based norms to compare. They're different for each age and each muscle, and a difference for males and females. So it really gives us a good idea when you're testing a 6-year-old versus a 70-year-old. Those norms are going to be different. So then we can tell if they're in the normal range for their age and sex. These are actually my daughters. I've been doing this a while, so these are now my young adults. They were modeling for me years ago. So again, the weakest muscle groups in our first cohort, you could see the gray or whitish line going across the horizontal line, shows you where the normal range is. I still feel like I'm gonna turn this. Okay, can you guys still hear me okay? So you can see this, this is the upper extremity muscles we test. We test more than those 4 muscle groups in our clinic, and we track those over time as well. But consistently, the elbow flexion seems to be weak, and the wrist extensors seem to be weak. And here in the lower extremities, this orange is hip flexors, and this ankle dorsiflexors are weak in both children and adults. We also test knee flexors, but just in children. And the knee flexors or hamstring muscles tend to be weak in children. We just don't test it in adults because that's not in our protocol. So, oh, yes, no problem. Yes, absolutely, thank you.
So the Coast uses the 4 weakest muscle groups that you guys found over time. So you
Correct.
tested all of the muscle groups over time and kind of analyzed, and that's how you chose those muscles.
That's how we chose the 4 muscle groups to focus on. And we'll go over we come up with a composite score at the end. So these 4 muscle groups, only on the dominant side, go into that composite score, but we still like to look at the other muscles. We still care about the other muscles because, of course, individually there are differences. Yes, we focus on that. Our assessments do get pretty long, so sometimes. Did you volunteer yesterday?
No,
okay.
I emailed you.
Oh, okay. Gotcha.
Looking at implementing something like this with our.
Oh, okay, great. Mm-hmm. Yeah, if you wanted to hone in on the most important muscles, you can test just the 4. Mm-hmm. Okay, great. Okay, back to the slide. So We heard from our patients time and time again that, yeah, I do pretty well on that first one, but if do it a few more times, and for sure they definitely fatigue over time. So we developed this test to test muscle fatigue, and it's 6 repetitions using the myometer. And as you can see in the bar graphs here, this light blue is the Z-score for the first rep, and that tends to be, for a lot of people, the mean is still in the normal range for patients with mitochondrial disease, where the 6th rep is below the normal range. And with our healthy controls, they pretty much stay in the normal range for the first rep as well as the 6th rep. Even though healthy individuals will tend to drop a little bit as well. That's normal. And here you see the little girl here. So as young as 5 years old, we do this testing. Okay. And then we also do our static balance positions. We do a single leg stance, both eyes open and eyes closed, and then tandem stance, eyes open and eyes closed. Oops, sorry. And again, yes, just the dominant leg. So for single leg stance, that means you're standing on your dominant leg. For tandem stance, your dominant leg's behind. And tandem stance tends to be really difficult in this group because it also involves a little bit of coordination. So sometimes that's even harder than single leg stance, but sorry, my videos didn't play there, but we're going to move on because I know everyone wants to get to the banquet tonight, right? We also take a look at dexterity testing. We use the 9-hole peg test, which is the video that's playing now. This could be very challenging if you have a tremor, if you have dysmetria, poor coordination, because you're taking a small peg and you're targeting into a small hole. Where the functional dexterity test really takes into account in-hand manipulation skills. And for this test, there's a lot of compensations that they don't allow you to do for the test. So this one can be very challenging, and they really have nailed the common compensations that people use if they don't have good dexterity. So again, those, and if you recall, if you're at Dr. Zakipli's talk, our dexterity scores tend to be really low, below the normal range. Our exercise and tolerance tests include the 30-second sit-to-stand and the 6-minute walk test. If you did come to our and volunteer at our research pavilion, we do test for a full minute in our clinic, but we didn't have great norms across the age span. But for 30-second sit-to-stand, we have nice norms from 3 years old, believe it or not, to 65 plus. So that's why we chose just to include the 30-second sit-to-stand in our composite score. And then our 6-minute walk test, which should be starting automatically. Okay, that one worked. And again, the 6-minute walk test can be challenging to keep, you're walking at a very quick speed, but you're not allowed to run. So in our mitochondrial patients, we keep track of each minute, how far they go. And so you can see if there's any fatigue over time, and we certainly see a drop in their distance each minute. Okay, and this is kind of a summary slide that Isaac, one of our research assistants in the audience, has really put some beautiful slides together for us of our data. So you can see, whoops, sorry. The pink scores are muscle testing, And the middle line there is the mean, and then -2 standard deviations we consider below -2 weak or below normal. So you can see most of our scores are below normal there for our muscles. You can see our 6 in a row repetitions, definitely below normal. And then our balance tests, some are falling in the normal range. Our tandem stance eyes closed is very challenging. And that's close to -2, a little below -2. Then here we have our exercise intolerance tests, and you can see they're below the normal range, especially our 6-minute walk test. And again, we look at both the total distance, so this would be the total distance Z-score that we're looking at here, but we also look at that fatigue during the 6-minute walk test. And then our last one is our dexterity measures, and you can see they're significantly below the -2. So here's another look at our data, but you can see in the top graph is our healthy control data. The scale is a little bit different. Our middle is at 0, and this only goes to -1. So you can see all of our testing falls in the normal range for our healthy controls, as it should. And then here, the scale is 0. This is the mean at the top. And this goes all the way to -4 standard deviations below the mean. And again, you can just see, obviously, our strength numbers are below the normal range for most muscle groups. There's a few extra muscle groups here. Interestingly, this is our hip flexor muscles, and they're below -2 standard deviations. But for some reason, our hip abductors are relatively preserved. So your hip abductors are the muscle group that brings your leg out to the side, where our hip flexors are our marching muscles. And in our group, for some reason, the hip flexors tend to be weaker than hip abductors. Most of our group are fairly strong in hip abduction. And then you could see similar results there, just another way to look at it. So here's our MM-COAST composite score. And this is how we come up with one number for all of those tests based on your Z-score, how you score in each of the 5 domains: muscle strength, fatigue, balance, exercise intolerance, dexterity. So basically, for instance, for elbow flexion, if you score -2 standard deviations below the mean, you would look at this chart A, and you would get an assigned score of 0. If, say, you score -3 in hip flexors, you get a score of a 1. So you add up all the scores, and then you divide by 4 for muscle strength, because you're looking at 4 different muscle groups. And that's how we come up with the domain scores along here for all of the tests except for muscle fatigue. And then we look at our muscle fatigue scores. And because we don't have normative data yet, since we developed this test, we use the percent decrement, and we assign a score for that, looking at chart B. And then you can come up with a composite score. So for our mitochondrial myopathy group, this is our initial cohort from the paper. And our mitochondrial patients scored a 1.3 on average. We had a group of unlikely subjects. They were basically people who came to clinic with an unconfirmed diagnosis, went through the testing. They were not suspected to have mitochondrial disease, and they were scoring about 0.5. Still a little bit higher than our typical healthy controls tend to be around -0.5. So it's not a big range of numbers, but the higher your score is, the more severe your disease symptoms are. And this is not diagnostic for mitochondrial disease. It's just a way for us to, again, track over time. There may be someone that comes in with another disease that might score get a high score on the coast, but not necessarily have mitochondrial disease. Does that make sense? And then you can see our ambulatory patients have a lower score compared to our non-ambulatory patients. Our non-ambulatory patients can do the coast testing, but obviously they're not going to be able to do the 6-minute walk test. Some of them can do the sit-to-stand test, it depends. But as long as they do muscle strength testing, the muscle fatigue test, and the dexterity testing, they can get an coast score. Oh, and in the paper we showed that the coast composite score correlated very significantly with the North Star functional measure. So this is my favorite slide. You saw this morning, and it just shows how heterogeneous our group is. And even you can see, it's hard to see all the different colors, but each color represents a different genetic etiology. And as you can see, there's like a light pink here that has a pretty decent coast score. But there's some other scores higher and higher. And just because you have the same genetic etiology doesn't mean you're going to present the same way. And we see this time and time again. We developed the mitochondrial mobility performance levels, the improved levels, and basically it's a functional classification system based on the mobility as well as fatigue level. So level 1 and level 2 are non-ambulatory, and then level 3 is patients that are ambulatory but at a household level. If they go out of the house, they will typically need a scooter or a wheelchair to do community level distances. And then levels 4 and 5, they're both ambulatory. They're able to walk around in the community, but level 4, they would have moderate fatigue. Level 5, minimal fatigue. And then level 6 basically have very little limitations. So we did have a poster. Unfortunately, they took the posters down pretty early, earlier than we expected, but the poster kind of goes, and the levels kind of go into more detail, so you can kind of, the clinician can kind of figure out what level their patients fit into. And when you look at our subjects by improved levels, this looks a little more organized and makes a little bit more, you can make a little more sense of our coast composite score data. So again, the level 2s are the non-ambulatory patients. So of course they have a higher score, composite score. And then our level 6s have a much better score. And we do have we have 14 mitochondrial patients that score in that high score, that level 6 score. But most of our patients fall in levels 4 and 5. This is just a look at our functional exam that we developed, and hopefully we'll be writing that paper soon. It's about 21 items, and it's more of a criterion-based test where you get a score for each item you complete from 0 to 3. So this score you want to be a higher score. Higher score means greater function for this test. And our adult patients scored a little higher than on average than our children. And our high score, if you max out the test, high score is 78. And this is similar data, again, to what you saw this morning. Originally, Dr. Zakipli's talk was going to be earlier in the week, so I was trying to bring some of this to our patients and families. But so sorry if this is repetitive if you went to her talk, but I just wanted to give you a look that our data that we collect. We can look at longitudinally, just like in those SMA papers that I showed you. So we are getting ready for clinical trials and getting to understand our disease progression much better. This is our MM-COAST composite scores. And we look at the slope of the lines, and for our composite scores, they are relatively stable over 40, even up to 60 months. And we'll continue to collect this data to watch it over time, but the change was not significant, so it's a pretty stable score over time, which is a good thing because that means most of our mitochondrial diseases are relatively stable. For our 30-second sit to stand and our 6-minute walk test, the change was significant. As you can see, over 3 months and over a year, there's a very slight change, minus 0.12 for 30-second sit to stand, and minus 0.16 of a z-score. Again, so these tests seem to be pretty sensitive and a little more, and these are exercise intolerance tests, so that's where you're gonna see a little more quicker decline, which is not surprising because that tends to be a big symptom. Our dexterity tests, functional dexterity tests, 9-hole peg tests, pretty stable over time. And the change was not significant. And I didn't want to forget our little ones. Under 5 in our clinic, we use the GMFM 88 functional measure. There's 88 items. So you can imagine you're testing little toddlers. There's 88 items, and you get a nice percentage. And you're looking at, can they roll? Can they do things on their stomach, on their back? Can they sit? And the higher level items are running and jumping. And there's our little girl jumping. There it goes, okay. And on the left there, this is how long it can take to test one item. Actually, she gets 2 scores if she does it on both sides. So it can be challenging at times. I'm trying to get her to stand on one foot holding the bench with one hand. So you have to get a little bit creative here, but I have to save this for when Dr. Falk says, oh, you can fit in a 3-year-old. That one doesn't take too long, do you? Does it? Like, no. But, so we have a way of tracking our younger patients over time as well. That is all I have. I just wanted to thank our Mitochondrial Medicine Frontier Program team. I'm gonna embarrass some people here. I'm gonna have Isaac and Diego stand up. They're some of our research assistants. Super helpful. And then in the back we have Stephanie Walters and Julia Fogliano. They were super helpful. We trained them and got them ready, and they've been crushing it in our research pavilion this whole trip, so it's been great. And then, of course, Lizzie Balance. She's one of our PTs. She has the best PT name, Lizzie Balance. She couldn't make it this year, but she is also in our clinic and tests patients almost every week. So I just want to, she contributes a lot to our data. I am not the only one collecting this data. So, and then of course UMDF, who helped fund and get us going on our natural history studies. And of course our CHOP patients and families. And all of you out there have helped us out in the pavilion this weekend.